Our bodies and their movements are greatly aided by the joints and bones. However, some conditions can hurt the joints and bones. We have discussed gout and arthritis, which affect the joints, in our previous videos. Now, we will talk about osteoporosis, which impacts the bones. Bone is a living tissue. It constantly revamps itself by growing new cells and breaking down the old ones. If the growth exceeds the breakdown, then the bones will improve. Like during our childhood, when our bones grow stronger, and our adolescence, where our bones grow longer and we become taller. The bone density peaks between 20 to 40 years of age. But when the balance shifts and the breakdown outdoes the growth, our bones become compromised and lose their density. Osteoporosis is a condition when our bones become less dense and become very fragile. It shows no symptoms and develops slowly in the background over the year. That is, until a common fall or simple impact suddenly breaks your bones. Unlike Paget's disease, which usually only affects a single bone or is localized in an area, osteoporosis is spread to all bones of our body. Risk factor. Women are more likely to suffer from osteoporosis, especially after their hormones change during menopause or postmenopausal osteoporosis. Osteoporosis runs in your family. A child with a genetic disorder can also suffer juvenile osteoporosis. Bad habits, such as drinking, smoking, and rarely exercise. Having a low body mass, with a body mass index less than 21. Receiving steroid treatment for 3 months. Self-help. The following advice can help you reduce the risk of osteoporosis. Add plenty of calcium and vitamin D as part of a well-balanced diet. They can be obtained from dairy products such as milk, cheese, and yogurt, along with milk made from soy, rice, or oats. Do exercise regularly, especially resistance training using dumbbells or posture training such as Tai Chi. Quit smoking and drinking if you are still doing them now. To treat your osteoporosis, you can consult with a rheumatologist. To diagnose, they would advise you on a particular test called DEXA scan for diagnosis. This test measures bone density. The possible results are normal, so the risk of a low-impact fracture is low. Osteopenia, which means that you have a small risk of a low-impact fracture, but your bone is already weaker than the average one. Osteoporosis, which is when you have a greater risk of low-impact fractures. Discuss this with your doctor as you may need treatment. This test is done before starting treatment and can later be repeated at 2 to 5 year intervals as per your doctor's advice. Treatments. Bisphosphonates, such as zoledronic acid treatment, will prevent bone resorption by binding to the bone mineral and induce apoptosis of osteoclast. Teriparatide, which is a synthetic, simpler human parathyroid hormone. It will promote the growth of the bone by decreasing bone turnover. Raloxifene, which has the benefit of estrogen hormone without its drawback, can treat postmenopausal osteoporosis. Denosumab, a monoclonal antibody, prevents the maturation of osteoclast. Treatments such as strontium ranelate are under scrutiny due to their dangerous side effects. All of them will help to increase the BMD or bone mineral density. After receiving treatment, inform your doctor whenever you encounter gastritis, which is the most common side effect, skin rashes, sore mouth, flu-like symptoms, jaw pain, headaches, and nausea. Remember, bone renewal is a slow process. Even though you won't be able to feel whether or not it's working, your bone density should start to improve after 6 to 12 months. Your doctor may suggest a break from your treatment after 3 to 5 years, but the effect of the treatment will still continue later.